I'm Ellen. I'm one of the pelvic health physical therapists in outpatient rehab here at Holland Hospital. If you're watching this video, you've gotten a prescription from your doctor for pelvic PT. We wanted to give you an idea what to expect coming to your first appointment, as well as a couple of exercises for you to do in the meantime to hopefully help manage your pain prior to your first appointment. Your pelvic floor muscles is a group of muscles that sits in the bottom of your pelvis. They play a role in our bladder, bowel, and sexual function. If for one reason or another these muscles have become strained, it can often result in pain, difficulties with urinating, having a bowel movement, placing a tampon, or with intimacy. On your first appointment, you will meet with one of our pelvic health physical therapists. We will discuss your specific concerns and goals with therapy. We will take a complete health history, including your bladder, bowel, and sexual health. We'll then do an external assessment of the health of the joints and muscles around your pelvis. Then, with your permission, we'll do an internal pelvic floor muscle exam to make sure that your muscles can contract, relax, and stretch properly. From there, we'll develop a treatment plan and give you more specific instructions for an individualized home exercise program. So here's a few exercises for you to try at home. The first exercise is called Diaphragmatic Breathing. What you're going to do is lie on your back with one hand on your abdomen. You're going to breathe slowly into your belly so that your hand rises with an inhale and then passively falls with an exhale. Perform this exercise for 5 to 10 minutes, a few times a day as needed. If you want, this exercise can also be performed in a seated position. The next exercise you're going to perform is called a cat-cow. You're going to get on all fours, so your hands are right underneath your shoulders and your knees are underneath your hips. Within a tolerable, pain-free range of motion, you're going to arch your back up so that your tailbone tilts underneath you, and then you're going to let your low back sag and your tailbone tilts outward. Be sure to continue breathing throughout this exercise. Perform about 20 reps a few times a day as needed. If getting into all fours is too difficult of a position, this exercise can be modified by bending forward over onto a countertop and performing the same type of motions. Lastly, we'd like you to try a deep squat stretch. So what you're going to do is lay on your back close to a wall with your feet propped up on the wall or a couch. You're going to stay in this position relaxed for about 2 minutes. Again, perform this a couple of times a day. If any of these exercises increase your pain, please stop and wait for your physical therapist to give you further guidance. Heat may also be a good option to help decrease your pain. You can place it over your lower abdomen or pelvis for about 5 to 10 minutes a few times a day as needed. A warm bath or a heating pad are both good options.